What is communication? Communication refers to the process of sharing information between two or more persons. It is also the transmission of thoughts or feelings from mind of a speaker to mind of a listener. It's active and dynamic. Both sender and receiver must be engaged. Receiver is constantly sending feedback that is interpreted and used by the sender. 3 basic functions of communication: to request, to comment, to reject. The process of communication is 1. Formulation, 2. Transmission, 3. Reception, and 4. Comprehension. Modality describes the manner in which information conveyed via communication is transmitted and received. Speech, most common for humans, sign language, reading, and writing. The model of communication includes a sender to formulate and transmit a message, a receiver to receive and comprehend the message, a shared symbolic system, information provided by the receiver to the sender, aka feedback. An effective communication is continually provided by the receiver and the sender responds accordingly. Is used by the sender and receiver to prevent communication breakdown from occurring. A closer look at feedback. Linguistic feedback includes speaking and vocalizing. Non-linguistic or extra-linguistic feedback refers to the use of eye contact, facial expressions, posture, and proximity. It may supplement linguistic feedback or can stand alone. Paralinguistic feedback refers to the pitch, loudness, and pausing of all which are superimposed over linguistic feedback. The purpose of communication. The main purpose is to provide and solicit information. Provide information about our feelings and get information from others. To share information about trivial and exciting events and to describe needs and desires. Communication functions. 1. Instrumental communication, regulatory, interactional, personal, heuristic, imaginative, and informative. 4 principles of effective communication: quantity, quality, relevance, and manner. How does communication relate to language, speech, and hearing? Language, speech, and hearing are essential ingredients of human communication. Language is used for formulation and comprehension. Speech is used for transmission. Hearing is used for reception. Language is a socially shared. A code is conventional, is a representative tool. Remarkable features of language: universality, species specificity, semanticity, productivity, rate of acquisition. Language domains: content, which is the meaning of the language, the words we use and the meanings behind them. Form, which is how words, sentences, and sounds are organized and arranged to convey content. Use, how language is used functionally for meeting personal and social needs. Language domains refined. Semantics are the rules of language governing the meaning of individual words and word combination. Syntax is the rules of language governing internal organization of sentences. Morphology is a form, rules of language governing the internal organization of words. Phonology, a form, rules of language governing the sounds we use to make syllables and words. Phonetics, rules governing how sounds are organized. Phonemes has about 40 depending on the dialect. Smallest unit of sounds, 15 vowels and 25 consonants. Pragmatics are the use. Rules of language governing how language is used for social purposes. Speech is the neuromuscular process that allows human to express language as a vocal product. It involves precise activation of muscles and 3 systems to transmit ideas: respiration, phonation, and articulation. Air begins in the lungs. Respiration travels through the trachea, over the vocal cords, and into the oral and nasal cavities. Phonation, and then is manipulated by the oral articulators. Articulation. Building blocks of normal speech. Breath stream begins with exhalation. Voice can impact speech: breathy, hoarse, broken, nasal, too loud, too soft, too high, too low. Articulation consists of omissions and distortions. Fluency, most functional when produced effortlessly and smoothly, with few hesitations, interjections, and circumlocutions. Hearing is an essential to reception and comprehension. Is the perception of sound, and when applied to the communication process, hearing is the perception of speech. Speech perception is the processing of human speech and is different from auditory perception. Sound fundamentals: creation of sound source, vibration of air particles, has frequency and intensity. Frequency is how fast air particles move back and forth, which corresponds to the pitch. Intensity is how far apart the particles move when going back and forth, which corresponds to loudness. Reception by the ear and comprehension by the brain. Reception by the ear, comprehension by the brain has one. Auditory centers in the brain are located in the left hemisphere. 2. If the information that is received is not speech, the speech and language centers are not involved. What is a communication disorder? A communication disorder or impairment is present when a person has a significant difficulty in one or more aspects of communication when compared with people sharing the same language, dialect, and culture. Disorder versus difference. A communication difference is present when a person's communication patterns differ substantially from those with whom he or she is communicating. Dialects. A communication disorder is present only when an individual's communication ability operates outside minimal norms or acceptability of one's culture or language group, is considered disordered by one's culture or language group, interferes with communication, or calls attention to itself within one's culture or language group. Classification of communication disorders: language disorders, speech disorders, hearing loss, feeding and swallowing disorders. Communication disorders, language disorders, refers to the significant breakdown in the linguistic system and has an impact of one or more following domains: semiotics, syntax, morphology, phonology, or pragmatics. It can affect children or adults. Language disorders that compromise reading development are called reading disabilities. Communication disorders, language disorders, child language disorders. Most common disorders of childhood can be developmentally or acquired. Communication disorders, language disorders refers to a significant breakdown in linguistic system that has an impact on one or more of the following domains: semiotics, syntax, morphology, phonology, or pragmatics. It can affect children or adults. Language disorders that compromise reading development are called reading disabilities. Communication disorders, language disorders. Child language disorders, most common disorders of early childhood, can be developmental or acquired, and SLI. Language disorders can be developmentally acquired or aphasia. Major reading disabilities. Major problems of reading is difficult with written language. Communication disorders, speech disorders, articulation, and phonological disorders are characterized by distortions, substitutions, and omissions. Fluency disorders, voice disorders, motor speech disorders include pathology is attributed to a dysfunction with the nervous system that controls motor output of the speech stream. Apraxia and dysarthria are examples. Communication disorders, hearing loss, can be present at birth or acquired. Sensorineural hearing loss, breakdown in the hearing system of the inner ear or the auditory nerve. Noise-induced hearing loss. Conductive hearing loss is the breakdown of hearing system in the outer or middle ear, malformation of the outer ear, torn eardrum, or fluid. Auditory processing disorder is the breakdown of processing speech sounds in the auditory center of the brain. Symptoms include difficulty paying attention, poor listening skills, difficulty following multi-step directions, slow processing time, and impaired language and literacy development. There's also swallowing of feeding disorders. Pediatrics is cleft palates, CP, prematurity, GERD, and brain injuries. Adult is CVA and progressive diseases. What careers are available in the field of CSD? Speech language pathology, audiology, Allied professions have a critical role in treatment of communication disorders. They are psychologists, pediatricians, neurologists, ENT, OT, and special educators.